Today is we are going to discuss part 23 NEET UG MCQs. Okay. So I am Dr. Shiban MBBS DCH, post graduated from Madras Medical College. My first question itself is a repeat MCQ. Actin is thin. True or false? Where have you heard this actin? Actin is found in actin and myosin. They are found in muscle. Okay. So actin is thin. True or false? Actin. Actin is a true statement. Okay. Each sarcomere has one A bond. True or false? Each sarcomere has one A bond. A band. A band. True or false? Very important MCQ. True or false? Come on. Come on. It is a true statement. Okay. Keep it in mind. Because these two MCQs, they are repeat MCQs. Okay. Each sarcomere has two I band. True or false? Each sarcomere has two I band. True or false? True or false? It is a true statement. Okay. Can you tell me which is half in related to muscle? Can you tell me a question? Half. Muscle. Two half I bands are present. Two half I bands are available. Okay. You remember? Okay, good. Can you give me two examples of polymerized protein? Polymerized protein. Polymerized protein. Actin, myosin. Actin, myosin. Question is polymerized protein. Troponin is a pigment. True or false? Troponin is a pigment. True or false? This is a repeat MCQ. Troponin is a protein. They can even ask troponin is related to which of the following, and they will give muscle. That itself they can ask in MCQ. Troponin is related to muscle contraction. Myoglobin is a protein. True or false? Myoglobin is a protein. True or false? Myoglobin is a pigment. Very important MCQ. Match the following. Myoglobin is a pigment. ATPase enzyme is found in the actin head. True or false? ATPase enzyme is found in the actin head. True or false? It is found in the myosin head. You can refer the page number also. I have taken all the questions which I have taken is from your NCERT 12th standard textbook. Okay. Actin has ATP binding site. True or false? Actin has ATP binding site. True or false? Myosin. Active site of actin is found in dash site. Active site of actin is found in dash site. Active site of actin is found in dash site. It is found in the myosin head. Active site of actin is found in dash site. It is found in myosin head. ATPase is found in which site? In muscle. ATPase is found in which site? In a muscle. All are very, very, very important MCQs, and most of them are repeated MCQs. Okay, so ATPase is found in dash site. Myosin head. ATPase is found in myosin head. Same question. ATP binding site. ATP binding site. ATPase binding site we discussed. I am asking ATP binding site. ATP binding site is also myosin head. We should not get confused. Okay, ATP binding site. Active site of actin. Active site of actin. What is active site? Myosin head. Okay, keep everything in your memory. Myosin head. Calcium in muscle is found in dash site. Calcium in muscle is found in dash site. Calcium in muscle is found in which site? Sarcoplasmic reticulum. Calcium in muscle is found in sarcoplasmic reticulum. A sensory nerve carries signal to muscle fiber. True or false? A sensory nerve carries signal to muscle fiber. True or false? It is a false statement because which carries? A motor neuron. A motor neuron carries signal to a muscle fiber. A motor neuron carries signal to a muscle fiber. Dash causes release of calcium from sarcoplasmic reticulum. Dash causes release of calcium from sarcoplasmic reticulum. Dash causes release of calcium from sarcoplasmic reticulum. The answer is action potential. See, the MCQs will be very tough. Just hear it very properly, okay? This they have asked in match the following. Crossing bridge is related to what? Crossing bridge. It is related to muscle contraction. This is the match the following question. Very tough MCQ. Crossing bridge is related to muscle contraction. See, they have scientifically proved that if you want to remember any study material, you must do 7 days continuous recall. If you hear this video for 7 days regularly without any gap, you will remember all the 100 MCQs in your fingertips. That is the power of regular recall technique. Most of the students, what they do, they keep on doing so many revisions. Revision is a useless thing. You can read the book once or twice. After that, you must practice 7 days continuous recall, where the top students who get 720 out of 720, they practice 7 days continuous recall. You try in this single video and you will find the benefit. Okay. hydrogen, potassium and nitric acid and ammonia NH3 are secreted by what? In which part of the kidney? Because all are individual MCQs. H plus secreted from which part of the kidney? Okay. Potassium secreted by which part of the kidney? Separate MCQ. NH3 secreted by which part of the kidney? All three are separate MCQs. I have given in total. Okay. Very, very important MCQ, but very confusing MCQ. You have to just renal tubule. Renal tubule. Renal tubule. Don't forget the question. Secreted, okay. Remember the word secreted. They'll keep reabsorbed. They'll confuse you. So, secreted is the key word. Urine is stored in which organ? Urine is stored in which organ in our body? Urine. Urine. Urine is stored in urinary bladder. I think you know this. Urinary bladder. Counter current mechanism happens in which organ in our body? Counter current mechanism happens in which organ of our body? Any idea? I'll give choice. Liver, spleen, heart, kidney. Counter current mechanism. The answer is kidney. Kidney. Don't forget. And especially which part of kidney is an MCQ? Henle's loop and vasa recta. Don't forget these two, okay? They'll give 4 choices and make us confused. Vasa recta is made up of capillaries. True or false? Very important. They'll give capillaries, arterioles, artery and venules. That will be toughest MCQ. Vasa recta is made up of capillaries. True or false? Yes, the answer is capillaries. Yes, the answer is capillaries. Filtrate is concentrated in descending limb. True or false? Very important MCQ. The word concentrated is important. Concentrated. They'll tell secreted. So filtrate is concentrated in descending limb. True or false? Very important. You think the diagram. Yes. Yes. Concentrated. Yes. Okay. They can also ask filtrate is concentrated in dash. That time you should tell descending limb. Filtrate is concentrated in dash. That time you should search descending limb. That is a separate MCQ. Okay. Okay. Filtrate is diluted. This is the keyword, diluted in ascending limb. True or false? This is how you should prepare for NEET. Filtrate is diluted in ascending limb. True or false? Diluted is the keyword. True or false? Yes, it is diluted in the ascending limb. Yes. In a kidney, 2 things are retained in interstitium. They will ask which of the following is retained in interstitium of kidney. Only 2 things. So they can ask keep any one. retained in interstitium. This is the depth of NEET preparation. Electrolytes and urea. Don't forget the question, okay? Electrolytes and urea, but don't forget the question. Don't forget the question. DCT and collecting duct. DCT and collecting duct concentrate the filtrate 4 times. True or false? One more MCQ they can ask here. One more question they can ask. Concentration of filtrate occurs in dash site. That time you should answer DCT and collecting duct. This is how we should catch an MCQ. What is the answer? DCT and collecting duct. Concentration of filtrate 4 times. They concentrate. Any idea? That's an MCQ. They'll ask 2 times, 3 times, 4 times, 5 times. Yes, it is 4 times. Yes, it is 4 times. Passing of urine is called passing of urine is called passing of urine is called micturition. Read the spelling. MICTURION. Read the spelling correctly. Micturition means passage of urine. Okay, micturition. Regulation of GFR. GFR means glomerular filtration rate. Glomerular filtration rate is MCQ. So regulation of glomerular filtration rate is by what? Is by juxtaglomerular apparatus. Juxtaglomerular apparatus. Juxtaglomerular apparatus. Don't forget the question. Okay. What is the question? What is the question? Regulation of GFR is by juxtaglomerular apparatus. HIV. What is HIV? Human immunodeficiency. What is the full form? I'll tell you later. Okay, tell the answer. HIV is a RNA virus. True or false? It's an RNA virus. True or false? It's very confusing, the examination hall. You'll confuse whether it's virus, bacteria, fungus, or whether it's DNA, or whether it's RNA virus or DNA virus. So HIV is a RNA virus. True or false? Is a true statement. HIV means human immunodeficiency virus. The word itself is the virus, but it is a RNA virus. Okay. See, this question I asked you. Concentration of filtrate. What is the answer? Concentration of filtrate in kidney. This is concentration. I'm telling about concentration. Okay. There. Descending limb. Correct? Concentration, descending limb. Dilution. Descending limb. Concentration and dilution both happens in descending limb. Right? Highest concentration of filtrate. Which site in kidney? These are repeated MCQs so many times my humble request, share this video for 7 continuous days. Because top scorers who get 720 out of 720, they don't reveal the secret outside. This is the secret of 720. Recall. Okay, good. See, what you are doing is recall, not revision. We are doing recall. Okay. What is the answer? What is the question? Highest concentration of filtrate. 2 answers. We discuss now. Concentration. DCT and collecting duct. You can see this page number in your textbook. DCT and collecting duct. Don't forget the question. Very important MCQs. See, Bowman's capsule encloses. You see the diagram. Okay. Bowman's capsule encloses dash to form Malpighian corpuscle. You should definitely memorize the diagram, that nephron, everything in your textbook. Okay. At least 10 times you should recall. Okay. At least 10 times. Continuous 10 days. Recall. Don't revision. No revision. Revision is useless. Bowman's capsule. What is the answer? Bowman's capsule encloses dash to form Malpighian corpuscle. If you know the diagram, you can answer this. Glomerulus will be there inside. Glomerulus. Humans have one pair of kidney. True or false? Be very careful in thinking this. One pair of kidney. True or false? Yes. One on the right side and one on the left side. So it is one pair. Okay. Female Anopheles mosquito causes typhoid fever. True or false? Female Anopheles mosquito causes typhoid fever. True or false? See, female Anopheles mosquito bite causes malaria. So typhoid is due to drinking or eating contaminated food. So the statement is false statement. Right? I told now, Anopheles mosquito bite causes malaria. See the purpose of the recalling. Infective form of malaria in human blood for the mosquito. Okay. Read the question thoroughly, okay. Infective form of malaria in the human blood for the mosquito bite. Or what will mosquito absorb from the blood directly? It absorbs gametocytes, not sporocytes. Be very careful. Sporocytes, it bites and spits into the normal human being. It sucks from the infected person. Very confusing in examination hall. Okay. Mosquito bites an infected person and sucks gametocytes. This gametocytes develops inside the gut of the mosquito. Then comes to the parotid gland, Parotid, parotid gland of the mosquito. And in the mosquito, this gametocyte is converted to sporocyte. It will be there. If it bites a person, that person will get malarial fever. There is a good cycle in your diagram, in your textbook. Just practice that diagram for 10 continuous days. So I made it very clear. Okay, gametocytes. Malarial parasite reproduces sexually in human liver. True or false? Malarial parasite reproduces sexually in human liver. True or false? It is totally asexual. It is totally an asexual. Okay. In humans, malaria parasite reproduces in only two sites. So they can ask on MCQ. Read the question thoroughly. In only two sites. Read the question thoroughly. It happens in liver cells and RBC. They'll confuse you. So many things they'll confuse. But our point is reproduces. That is the point. Reproduces is the point. Reproduces. Got it? Huh? Very important, okay? That's I'm showing repeatedly. Reproduces. See, this question I taught you right now. Gametocyte is found in the salivary gland of infected mosquito. True or false? Very confusing questions. But if you memorize that cycle of malaria, of mosquito cycle for 10 continuous days, not 2 days or 1 day, 10 continuous days, you should memorize that diagram. Then only you can answer. What is the answer? It is definitely sporocyte. It is definitely sporocyte. You want to read the question? Hear the video once more, okay? Not once more. Please hear the video like a topper. 7 continuous days. Because it's a proven study. It's not my story. See, blood meal of Anopheles mosquito. Blood meal of Anopheles mosquito. Blood meal means when it bites a infected person. Blood meal of an Anopheles mosquito has sporocyte. True or false? It cannot be sporocyte at all because taking a blood meal from the human being, RBC, it has to be gametocyte. It has to be gametocyte only. Don't confuse with sporocyte. So this is again an MCQ. True or false? Okay. Fertilization occurs in gut of mosquito. True or false? Mosquito is the keyword. Anopheles mosquito is the keyword. Don't think human beings. Because in human beings, it have got. Just now I discussed about human beings. I am talking about mosquito now. True or false? Yes, it is the gut. Page number you can see the textbook. Okay. Yes, but don't forget the question. Answer is gut. Don't forget the question thoroughly. Have you heard about this oxalate? OXOLATE. What is oxalate? Any idea? Oxalate. Oxalate is a kidney stone. Very important, match the following. Oxalate is a kidney stone. Kidney stone is also called kidney stone. Kidney stone is also called renal calculi. RENAL. Renal means kidney. Calculi means stone. Calculi means stone. They can ask that also as MCQ. Very silly questions they will ask and make it a big issue. Actually, it is nothing. Renal calculi is kidney stone. This question is a repeat MCQ. Sterols, hydrocarbons, and waxes. Do you know they will keep one more choice and they will ask which is the wrong statement. Sterols, hydrocarbons, waxes. Can you tell the question for this answer? This is the classic NEET preparation. Sterols, hydrocarbon, waxes. Anywhere did you study? In your textbook. You can remember anything from the textbook only if you have done a 7 days continuous recall technique, not revision. Tell me the answer. Question. Any idea? Eliminated by sweat glands. Name 3 things which are eliminated by sebaceous glands. Sebaceous glands. So they will keep one more choice and make you confused. Or they will ask sterols is eliminated by dash. Number 1, sweat glands. Number 2, sebaceous glands. Number 3, both of the above. Number 4, none of the above. That will be the toughest MCQ. So try to create your own MCQ questions from this video. Sterols, hydrocarbons, waxes. Eliminated through sebaceous glands, not sweat glands. Eliminated sebaceous glands. I made it very, very, very clear for you. Sebum, like my name. My name is Sheban. Okay, it's like that. Sebum, not Sheban. Sebum is a watery fluid. Any idea? Sebum. Sebum is a oily fluid. Sebum is a oily fluid. Sebum contains sodium chloride. True or false? Sebum contains sodium. Sometimes the sweat will be, if you lick the sweat, it will be like salty taste, no? Salt. Have you licked it? Salty taste. Why? Sebum secretes sodium chloride. True or false? Sebum is secreted by the sweat glands, not sebaceous glands. Sebum contains sodium chloride. So, sodium chloride is secreted by sweat glands. I confused, okay? Sodium chloride is secreted by sweat glands, not from sebum. Little bit confusing, you have to memorize. The very easy technique is 7 days continuous recall, otherwise you will forget. See, urea is found in sebum. True or false? This is the classical NEET preparation. Urea is found in sebum. True or false? UREA. Urea is found in sweat glands. Sweat or sweat gland or sweat. Sweat contains sodium chloride and urea. Sweat glands or sweat contains sodium chloride and urea, not sebaceous glands. Coding effect on skin. Coding effect, this is a repeat MCQ. Coding effect of skin is by sebum. True or false? Coding effect. Coding effect. Coding effect. When you see the word coding effect, you must automatically, your mind should come for sweat or sweat glands, something. So sodium chloride, sweat gland. Urea, sweat gland. Coding effect, sweat glands or sweat. They can ask and match the following. This I think you know. Cooling of the skin. Cooling, so cool. Cooling of the skin is by sebaceous glands. True or false? Cooling of the skin is by sebaceous glands. True or false? When you find the word cooling, you must remember sweat gland. For sweat gland, 4 questions. Sodium chloride, NaCl, urea. Next, what is that? Cooling effect. And one more thing. Coding effect. Coding effect. Cooling effect. Sodium chloride, urea. I made sweat gland very, very easy for you. Interferons are secreted from. They have asked this question so many times. Interferons are secreted from. First choice is virus, second choice is bacteria, third choice both, fourth choice none. Gone. Interferons are secreted from virus infected cell. Keep it in mind so strongly. Interferon is secreted from Interferon. Interferon is secreted from virus infected cells. The word memory, MEMORI, why, is for innate immunity, INNATE. True or false? The word memory is for innate immunity. True or false? It is for acquired immunity. Very important. Acquired immunity. Primary response is for innate immunity. True or false? Primary response is for innate immunity. True or false? Come on. Primary response is for acquired immunity. Okay. Primary response is for acquired immunity. So 2 things for acquired immunity. One is memory. Second is primary response. Okay. Even secondary response is for acquired immunity only. 3 things you can keep in mind. Memory is for acquired immunity. Primary response is for acquired immunity. Secondary response is for acquired immunity. Low intensity. Any idea? Low intensity. If you know this low intensity point, you can answer a tough MCQ. I am going to tell that. Primary response in acquired immunity is of low intensity when compared to secondary response. Primary response is of low intensity. Primary response is of low intensity than secondary response. What is anamnestic reaction? ANAM. NESTIC. Anamnestic reaction. Also called what? Other name? Anamnestic reaction. Anamnestic response. It is nothing but the secondary response in acquired immunity. I told acquired immunity 3 points. Memory, acquired immunity, primary response, acquired immunity, secondary response, acquired immunity. 3 are MCQs. Okay. They are not innate immunity. All the 3 are acquired immunity. So what is the question? What is anamnestic? This one. They can ask anamnestic also. Anamnestic means secondary response. Good. See, repeat MCQ. Memory is typical for innate immunity. True or false? Memory, I told you just now. It is for acquired immunity. This is super MCQ. B lymphocytes and T lymphocytes both secrete antibodies. No. B lymphocytes help T lymphocytes to produce antibodies. Come on. Let me see how brilliant you are. B lymphocytes help T lymphocytes to produce antibodies. If you know one basic point, you can answer this question. True or false? It has to be a false statement because the vice versa is true. Got it? T lymphocytes help B lymphocytes to produce antibodies. Or you must know one more important point. You must know that T lymphocytes do not produce antibodies. Only B lymphocytes produce antibodies. That time also you can answer this question. I'll repeat. T lymphocytes do not produce antibodies. B lymphocytes produce antibodies. If you know this point, see, now you can understand. True or false? Read it. See, B lymphocytes help T lymphocytes to produce antibodies is a false statement. I made it very clear. Okay. T lymphocytes, no antibodies. B lymphocytes secrete antibodies. Just memorize it. Okay. Each antibody has 4 peptide chains. True or false? Or they can ask, each antibody has how many peptide chains? 1, 2, 3, 4. They can give any choice. For that you should study like this. Each antibody has 4 peptide chains. Don't forget the question. Don't concentrate on 4. Forget to read the question well. Each antibody has 4 peptide chains. True or false? Yes. Yes, it's true statement 4. H2L2 is for what? H2L2. H is for heavy chain. L is for light chain. So now you know the answer. H2L2 is for what? Any idea? H2. Same thing they will ask. NEET. Antigen. Antibodies. They will keep antibodies, antigen, both, none. Be very specific. H2L2 is for antibodies, heavy chain, light chain. You remember the diagram? Immunoglobulin, the diagram. Antibodies have one light chain and one heavy chain. True or false? Antibodies have one light chain. Antibodies have one light chain and one heavy chain. True or false? True or false? Just now I told you, no. H2L2. H2L2. Two light chains, two heavy chains. Remember, just now I told you, H2L2. This is called NEET preparation. H2L2. So, two light chains, two heavy chains. Read the question. I made it very clear. That is the power of 7 days continuous recall. You practice this video for 7 days, okay, continuously. I'll challenge you. In this video, you will definitely get minimum 5 to 7 MCQs out of 90 MCQs in biology. I'll give 100% guarantee. 5 to 7 MCQs. Yes. Antibodies are, even if you don't get direct MCQs, if you know these points, you can answer some toughest MCQs. That is I'm telling you, 5 to 7. Minimum. Antibodies are found in liver. True or false? Antibodies are found in liver. True or false? Found in blood. See how easy question. We will get, we keep on thinking, we will forget. That is why I am telling you, recall technique is very important. CMI is an innate immunity. True or false? CMI is an innate immunity. True or false? No, it is an acquired immunity. Acquired immunity. Memory, acquired immunity. Primary response, acquired immunity. Secondary response, acquired immunity. Remember? Now, cell-mediated immunity is an acquired immunity. And one more thing is acquired immunity. Shall I tell you? Shall I tell you? Humoral immune response is also acquired immunity. Secondary other name, no problem. See, humoral immune response is an innate immunity. True or false? Just now what I told you. See, these are very confusing, but very easy. 7 days recall, okay. So, acquired immunity, what are the questions? Memory, acquired immunity. Primary response, acquired immunity. Secondary response, acquired immunity. Cell-mediated immunity, CMI, acquired immunity. Humoral immune response, acquired immunity. 5 MCQs, acquired immunity. Very important, okay. So, what is the other name of secondary response? I told you, what is the other name of secondary response? Anamnestic response. Anamnestic response. You see the spelling, okay? See, super question. Anamnestic response is an innate immunity. Very easy. That's why I told you, NEET is very easy. But you people should do 7 days continuous recall. Okay. This is what you are discussing only short term. Tomorrow afternoon you will forget everything. So 7 days continuous recall. Anamnestic reaction is a acquired. Secondary response. See how nicely I have written for you. Good. See, lungs is affected in typhoid fever. True or false? Lungs is affected in typhoid fever. True or false? Lungs. Lungs. We have 2 lungs. Lungs is affected by affected by 3 important diseases. Number 1, pneumonia. Number 2, asthma, ASTHMA. Number 3, emphysema. All are separate MCQs. That is what I am telling you. EMPHYSEMA. Number 4, tuberculosis. They'll ask, in emphysema, which organ is affected? That time we should say lungs. That's some teaching. In asthma, which organ is affected? Lungs. Pneumonia, which organ is affected? Lungs. Ulta. They can ask ulta question. So, lungs affecting diseases, 4 diseases. There's so many things important. Number 1, tuberculosis affects lung. Asthma, ASTHMA, affects lung. Pneumonia, just now we discussed. PNEUMONIA, pneumonia affects lung. 4th MCQ is very important, repeatedly asked. Emphysema, EMPHYSEMA, emphysema affects lung. 4 ulta questions for you. Okay. Intestinal perforation is common in pneumonia. See now, because you know that point, you can say this is wrong statement. You know pneumonia affects the lungs. How can intestine perforation come here? So intestinal perforation has to be some other disease, no? Tell me what all affects the intestine. Common thing is typhoid fever. That typically affects the small intestine. Typhoid fever typically affects the small intestine. Is an MCQ. So intestinal perforation comes in typhoid. Made it very easy for you. Separate little depth MCQ. Typhoid fever affects which intestine? They'll ask. That time we should be more specific, saying small intestine. That is separate MCQ, okay? Because large intestine is mainly affected by amoebiasis. That is also another MCQ. Small intestine is affected by typhoid. Large intestine is affected by amoebiasis. Both are separate MCQs. Done? Good. Hemophilus causes malaria. Hemophilus causes malaria. Come on. Hemophilus causes malaria. True or false? Hemophilus causes pneumonia. Hemophilus causes pneumonia because Hemophilus is a respiratory pathogen. This Hemophilus is a respiratory pathogen, so it causes pneumonia. Malaria is caused by female Anopheles mosquito bite. Influenza causes dash disease. Influenza causes dash disease. They'll give one choice. This is how we should prepare for NEET. Again I will tell you, revision is useless. Influenza causes dash disease. They'll give 4 choices. Pneumonia. Pneumonia is a disease of lungs. That is a separate MCQ. Pneumonia is a disease of lungs. Hope you will not forget me and all these MCQs also. Good. Streptococcus causes dash disease. Streptococcus causes dash disease. Streptococcus causes dash disease. Pneumonia. So pneumonia we have discussed 3 questions as MCQ. Number 1, influenza causes pneumonia. Number 2, Hemophilus causes pneumonia. Number 3, Streptococcus causes pneumonia. They will keep one more wrong choice and they will ask which is the wrong statement. See, NEET is very easy. So pneumonia, 3 things. Hemophilus, influenza. What else? Hemophilus, Next, influenza. Next, streptococcus. See, my humble request to do the 7 days continuous recall and do an experiment. After 7 days, you'll enjoy. You'll have so many points inside your brain. What is plague? Plague. Plague disease. Have you heard about this? Plague disease. Plague disease is caused by bacteria. True or false? They'll give 3 virus diseases. Viral. VIRAL. They'll give 3 viral diseases. They'll keep this plague and they will ask which one of the following is a bacterial disease. So if you know plague is caused by a bacteria, if you know the answer, plague is caused by the bacteria, is a true statement, you can answer that tough MCQ. You just have to know plague, bacteria. Other 3 things, even if you don't know, you can answer. That's what I'm telling you. This single video, you can answer 5 to 7 MCQs. Definitely. So dysentery is caused by bacteria. True or false? Dysentery can be caused by bacteria. Yes. Diphtheria is a bacteria. True or false? I told you 3 bacteria. Keep it in memory. Diphtheria is a bacteria. True or false? True. So 3 bacteria I told. Okay. Keep it in mind. Okay. Common cold. This is called common cold. Common cold is caused by bacteria. True or false? Common cold is caused by bacteria. True or false? This is a wrong statement because common cold is caused by ordinary virus. Ordinary virus causes common cold. We get frequently cold, no? Ordinary virus infection. Okay? Good. So, which virus causes common cold? Which virus? Which virus causes common cold? This is called rhinovirus. Or they can ask ulta. Rhinovirus causes which of the following diseases? So, common cold will be there in the choice. That time you should remember me, okay? Rhinovirus, common cold. Okay? Rhinovirus, common cold. Luckily, remember me. Rhinovirus, common cold. Malaria is caused by bacteria. True or false? Clear? Question answer. Malaria is caused by. Malaria is caused by bacteria. True or false? Malaria is caused by protozoa. Malaria is caused by protozoa. So this question was an interesting question, a tough MCQ which was asked last year MCQ. Very tough MCQ. So many people did not do this MCQ because the choice was 3 to 7 days is the correct answer. Last year they asked same question. 3 to 7 days. Do you know the question? Days, DAYS is the important point. Normal duration of common cold. They kept this as NEET last year MCQ. 1 to 2 days, 3 to 4 days, 3 to 7 days, 7 to 10 days. Last year MCQ, 3 to 7 days. Rhinovirus causes pneumonia. Rhinovirus causes pneumonia. Rhinovirus causes common cold. Simple. Rhinovirus causes common cold. It is very simple, only till tomorrow afternoon. But don't forget to do the 7 days continuous recall. Okay, very important. Lungs not affected in which important infection? This lungs is not affected in which infection? Common cold. It will be here only. Common cold, lungs is not affected. It is an upper respiratory tract infection. Okay, they can ask which organ is not affected in common cold? Lungs. Common cold is non-infectious. Non-infectious means what? Infectious means what? It will spread from one person to another. If a disease spreads from one person to another by coughing or sneezing, that is called infectious disease. Okay, so common cold is non-infectious. It is a wrong statement. Right, it is a wrong statement. So common cold is an infectious disease. It will, right. See, common cold is transmitted by mosquito. They will ask which of the following disease is not transmitted by mosquito. They will give 4 choices. Number 1, dengue fever. Number 2, chikungunya fever. Number 3, filariasis. Number 4, common cold. This is how they will prepare for NEET questions. Very easy. These 3 are transmitted by mosquito. Separate MCQ I am telling you. Dengue fever is transmitted by Aedes mosquito, MCQ, Aedes. Chikungunya fever is transmitted by same Aedes mosquito, Aedes. Filariasis is transmitted by Culex mosquito, Culex. All the 3 are separate MCQs. But if you know this point, you can exclude that MCQ. Common cold, what is the answer? Respiratory droplet. I told no. Coughing, sneezing, it will spread from one person to another person. It will not spread from me to you, because you are in the YouTube channel. Okay, right. Antibodies are related to cell-mediated immunity. True or false? If you know one important point, which I discussed in the beginning, you can answer this question. Antibodies are related to cell-mediated immunity. True or false? Antibodies are related to cell-mediated immunity. True or false? It is a false statement, because antibodies are related to humoral immune response. Antibodies are related to humoral immune response. Antibodies are related to humoral immune response. I made it very clear. And humoral immune response are related to only B lymphocytes. So, B lymphocyte secretes antibodies. So, antibodies are related to humoral immune response. Once more I will repeat. Humoral immune response related to only B lymphocytes, not T, only B lymphocytes. B lymphocyte secretes antibodies. So, antibodies are related to human immune response. Now, read this question. Antibodies are related to cell-mediated immunity is a wrong statement. It's a wrong statement. Graft rejection. Have you heard about grafting? Skin grafting. Skin grafting. Have you heard about that? Skin grafting. There are so many grafts. So, graft rejection is a humoral immune response. True or false? Graft rejection. Repeat MCQ. At the same telling you. Graft rejection is by cell-mediated immunity. Graft rejection is by cell-mediated immunity. So that is a false statement. This is a repeat MCQ. Last year MCQ. Last year. Antibodies are found in colostrum. COLOSTRUM. Antibodies are found in colostrum. Colostrum has dash antibodies. Colostrum means breast milk. First few days breast milk from a mother is called colostrum. First few days, maybe around 6 days. First 6 days, colostrum. First 6 days breast milk from a newly delivered mother is called colostrum. Okay, very important. So colostrum contains what antibodies? IgA. Because the first alphabet is A. This is the first milk. First milk will give the first alphabet. I made it very easy for you, okay? So they can ask ulta. IgA antibodies found in for a choice they'll give. That time you have to see for colostrum, just answer. That's why I'm telling you. NEET is easy, man. IgA antibodies, colostrum. Like that also they can ask. First response. The point is first response. When a host, like me, example, host is exposed to antigen. See, if I am exposed to pollen grains from a flower which are allergic to me, so what will be the first response in my body? So I am the host. What will be your answer? Antigen. Pollen grains are antigens. What will be the first in my body? So antigen is coming through my nose. So my body secretes antibody. Antigen comes in, my body secretes antibody to protect that, to protect me. So antibody is a protective response. See the answer? Antibodies are produced. See, now if you read the question, you can answer. First response when a person is exposed to antigens. First response when a protein is responds to antigens, antibodies are produced. Good? I made it very clear. See, write some good comments in the comment section, okay? I have explained so nicely, and kindly share this great important video with your juniors, with your seniors, classmates, with your class madam, biology madam, and even to your NEET coach. Let them also learn how to prepare for NEET. Okay. After hearing this video, my part 24 is available in the same YouTube channel. Hear that video also. Okay. Good. Now I am talking about active immunity. See, if you think of active immunity, that word, we will think active immunity is very speed. Right? We'll think like that only, examination hall. Active immunity is so speed. What is the answer for this? Active immunity is very speed. True or false? Actually, it is very slow. It is very slow. This is how we should prepare for NEET. Recall technique. Okay. Immunization is an example of dash immunity. Slow immunity, immunization. If I give vaccine today, it will take few days to get the body full immunity. It will take some few days. Vaccination means immunization, all same. So what? So it has to be active immunity. Active immunity. That's all. So don't forget, slow immunity means active immunity. Is the correct statement. Sometimes ready-made antibodies will be given to the patient directly. Ready-made antibodies. So it is an example of what? Ready-made antibodies gives dash immunity. Ready-made antibodies gives dash immunity. It will be already, it will be already there in our body at birth itself. Our tear has antibodies naturally. Our saliva contains antibodies naturally. Our mucosa of the intestine and all, they have antibodies naturally. That is why ready-made antibodies gives dash immunity. It will be at birth itself. So the immunity at birth means ready-made antibodies. It is called passive immunity. But I have covered 5 MCQs here. If you know this point, you can answer 5 MCQs. See, colostrum is an example of. It is already in our body, in the mother's body. So colostrum is an example of passive immunity. Because colostrum contains antibodies, you know that. So colostrum is an example of passive immunity. Tear is an example of passive immunity. Saliva is an example of passive immunity. Mucus in the respiratory tract, GIT tract is an example of passive immunity. Okay. One more example, passive immunity, I'll tell you easily. Immunity transmitted from the mother to the pregnant fetus is an example of through the placenta. Is an example of passive immunity. See, mother is pregnant. Immunity from the mother transmits to the fetus in the uterus. Example of passive immunity. I made it very clear. Passive immunity, I made it very clear with classical example. See, now you will answer this question. Antibodies through placenta. Antibodies through placenta in fetus from a pregnant mother is an example of what immunity? Passive immunity. That's all. Inborn, not inborn, is already present in the human system. Okay, for example, I am giving a vaccination from outside or immunization from outside, immunization injection. It is an active immunity. But it is slow. Active immunity is slow. It's an MCQ. So passive immunity means ready-made antibodies, which is already in our body. Passive means ready-made antibodies. Directly it will go to the right. Good. Cirrhosis affects which organ? So don't forget Sheben, okay? Don't forget Sheben when you write the exam. Okay. Cirrhosis. Which organ is involved in cirrhosis? CIRRHOSIS. Frequently asked MCQ. I will give a clue. Cirrhosis because of drinking alcohol. Drinking alcohol causes cirrhosis is a separate MCQ. No jokes. Alcohol causes cirrhosis. So, cirrhosis is a disease of liver. Alcohol affects liver. So, cirrhosis. Got it? So, what is the reason of cirrhosis? They will give 4 choices. You have to click alcohol. Good. See how brilliantly I have prepared a question. Alcohol intake causes hepatitis B disease. Alcohol intake causes hepatitis B virus disease. True or false? No. Alcohol intake causes cirrhosis of liver. MCQ. What is CO? What is CO? carbon monoxide. What is CO? CO, carbon monoxide. Dash increases the carbon monoxide in our blood. Dash increases the carbon monoxide in blood, not carbon dioxide. I am discussing carbon monoxide in blood. Be very specific. Which one? Smoking. They can ask another question. Smoking increases dash in blood. They will give carbon dioxide, they will give nitrogen oxide, they will give CO, and they will give one more choice. This is NEET. Ulta study. So smoking increases carbon monoxide in blood is a classical point. Don't study from this to there. Study from that to this. Smoking. What MCQ they can ask? Okay, increases carbon monoxide in blood. Okay. Heroin is a opioid. True or false? Because they can ask which one of the following is a opioid. They'll give 4 non-opioids. Which one of the following is a opioid? If you know this, you can answer. Heroin is an opioid is a true statement. Heroin is a opioid is a true statement. Symptoms in AIDS patient. AIDS patient occurs around within 1 year of infection. True or false? Symptoms of AIDS infection. Symptoms in AIDS patient. Okay. Symptoms in AIDS patient occurs within 1 year. True or false? This is how you should study NEET. Repeat MCQ. Not my joke. Not for joke. Your book, your textbook says 5 to 10 years. 5 to 10 years. Don't forget the question. 5 to 10 years. Do you know to expand AIDS? Acquired immunodeficiency syndrome is a separate MCQ. Acquired immunodeficiency syndrome. Effector cells found in which place? Any idea? Effector cells found in which place? I'll tell you how they'll ask an MCQ. Okay, you'll be shocked. Yes. Effector cells found in which place? We know this. Secondary lymphoid organs. Okay. Effector secondary. Okay. So I'll teach you one important point. They'll ask, in which of the following effector cell is absent? You know effector cells are present in secondary lymphoid organs. There are so many secondary lymphoid organs. Very difficult to remember. If you know, there are only 2 primary lymphoid organs. If you know those 2, you can answer this question. The 2 primary lymphoid organs are bone marrow, thymus. Bone marrow and thymus are the only 2 primary lymphoid organs. So they'll ask, effector cells are present in. So if you should see for thymus and bone marrow. So effector cells are found only in secondary lymphoid organ. Keep it in mind. So you remove the primary lymphoid organ if you know the question. So effector cells are found only in secondary lymphoid organ. I made it very clear. Effector cells are found only in primary lymphoid organ and secondary lymphoid organ. Second lymphoid organ. The two primary lymphoid organs are bone marrow, thymus. The two primary lymphoid organs are bone marrow, thymus. Separate MCQ. 1981. What is the significance? Repeatedly. Every year they last 1 year. 1981. 1981. Any clue? First case of AIDS was found out in 1981. AIDS is a congenital disease. Same word they are given in a textbook. Same word. AIDS is a congenital disease. True or false? It is a false statement. AIDS is not a congenital disease. Same word they are given in your textbook. Group of symptoms is called what? Means so many symptoms. Headache, fever, running nose, oral pain, stomach pain, shoulder pain, so many symptoms. Leg pain, constipation. Group of symptoms is called, group of many symptoms is called syndrome. 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 HIV belongs to dash viral group. HIV belongs to dash viral group. HIV belongs to dash viral group. Retrovirus. RETRO. Virus. Retrovirus. What is de-addiction? De-addiction. There will be cigarette addicts, alcohol addicts, some drug addicts. They'll use some injections and all. Heroin injection. So de-addiction is for alcohol, drugs, smoking. They'll keep one more choice here and make you confused. Heroin. So many people are using heroin injections. Heroin injections. That is a MCQ. That is I am discussing with you. So injectable addictive is heroin. Okay. Adolescence means which age group? Adolescence. ADOLESCENCE. Adolescence means which age group? Are you an adult? Are you in adolescence? Are you in adolescence age group? Think for yourself. Are you in adolescence age group? If you are within 12 to 18 years, you are adolescence. Okay, MCQ. Okay, you are adolescence or not? You are in adolescence or not? Euphoria is seen in sleeping. True or false? Euphoria is seen in sleeping. True or false? Euphoria. MCQ. Euphoria is seen in addiction. Alcohol addiction, drug addiction, all addiction cases. Euphoria. MCQ, okay? MCQ, rank deciding MCQ, euphoria, alcohol addiction, euphoria, some addiction. What do you mean by withdrawal symptom? WITHDRAWAL, withdrawal symptoms. Withdrawal means sudden stopping of alcohol drinking. They'll drink for 25 years and suddenly they'll stop. Today they'll stop. So next day they'll get so many withdrawal symptoms. They'll get tremor, like this they get tremor, they cannot sleep. So many count. That is called withdrawal symptom. Okay. So withdrawal symptoms are typical for any addiction, specifically alcohol, smoking, some addiction. Sudden stoppage of alcohol. Example I have given. Any drugs, sudden stoppage causes withdrawal symptoms. If you understand, you can answer in MCQ. Okay. Smoking and alcohol is mostly seen in old age people. True or false? True or false? Or you should say which age group so many people are smoking and drinking. Which age group? MCQ. Not for joke. Same adolescence. 12 to 18 years. Same line they are given in your textbook. Okay, not my story. So it will be in your NEET MCQ. Vandalism. Vandalism. What do you mean by the word vandalism? Any idea? You check in your textbook and write it in the comment section. Okay, vandalism meaning. Okay, but I'll talk about MCQ now. Vandalism is typical for alcohol abuse. Single answer. Vandalism. Vandalism. Okay, vandalism. You should find out the meaning and inform me through phone. Okay? Yeah? Right. Cause of death in drug abuse. Cause of death in drug abuse. They are given 3 causes. So in the examination hall, NEET, they will keep one more choice and they will ask which is the wrong thing. So I write anything in 3, you have to write it down. Causes. 3 things they are given. One is respiratory failure. Next, heart failure. 3 is cerebral hemorrhage. We will remember easily. Okay, first is cerebral hemorrhage. From top will come. First is cerebral hemorrhage. Next is respiratory failure. Third is heart failure. Cerebral hemorrhage, respiratory hemorrhage, heart failure. If they give some other thing, you remove the choice outside. Okay, I made it very clear. This was a confusing MCQ. So many last year they have asked. Hepatitis B is a virus. True or false? Hepatitis B is a virus. Is a true statement. Hepatitis B is a virus. AIDS. AIDS is caused by virus. True or false? AIDS is caused by virus. True or false? AIDS is caused by virus is a true statement. AIDS is caused by virus. This is a tough MCQ actually. When you see 4 choices, single choice is easy. When they give 4 choices, it's tough. Okay. Name 2 diseases which are transmitted by sexual mode of transmission. By sexual contact. The sexual contact. One AIDS, that you know, sexual contact. But the second choice, you will not imagine at all. It is hepatitis B virus infection. AIDS you will answer, no problem. But second choice you cannot answer. Hepatitis B, sexual contact also is there. See, sharing of needles and syringes. For example, sharing of needle and syringes of different patients, taking blood from that patient, again giving same, can cause what disease? You know AIDS. Anyway, AIDS you know. Sharing of needles also transmits hepatitis B virus infection. Hepatitis B virus infection. Name 2 diseases which can be transmitted through infected blood. They will do blood transfusion now. From that person to this person, blood transfusion. In surgeries, when they do surgery, they will do blood transfusion. From that person to this person, they will take blood. You heard about that? Blood transfusion, A blood group, A positive, B positive. What disease can be transmitted? Same, AIDS, hepatitis B, virus. I made it very clear. See, what a fantastic question. You all know the answer. Smoking causes cirrhosis of liver. If you know this point, sometimes you can answer some other MCQ. Smoking causes cirrhosis of liver. Smoking. I told you now, alcohol or some drugs taken for a long time can cause cirrhosis of liver. Smoking will cause lung cancer. Smoking will cause asthma. Smoking will cause emphysema. Smoking will cause anything related to the lungs. Smoking, okay? HIV. What is HIV? AIDS. AIDS is called HIV. HIV is transmitted through placenta. True or false? HIV is transmitted through placenta. That means from a pregnant mother to her fetus. True or false? It's a true statement. It's a true statement. AIDS spreads through mere touch. If I touch an AIDS patient, if I touch some other AIDS patient, will it spread to us? That is the question. Because AIDS is a dangerous disease. AIDS AIDS spreads through mere touch. True or false? Or can you touch a AIDS patient? Never. AIDS will never spread by mere touch. So you can touch an AIDS patient. No problem. Okay? Okay? AIDS transmitted by physical contact. I told no. Because this word same thing in the given in the book. AIDS a physical contact. Never. Never. Okay? So only way of spread of AIDS. Only way of spread of AIDS. Only way of spread of AIDS is body fluids, blood transfusion, something like that, some body fluids. AIDS patients must be isolated from the family. It is given so nicely in your textbook. It is given so nicely. These are rank deciding MCQs. AIDS patient must be isolated from your family members. Never. Can you tell me this? This is a repeat MCQ, 5 to 10 years. Can you tell me the question? Come on, let me see your memory. See, that is I am telling you repeatedly. This is only short-term memory. You must recall this video for 7 continuous days. Okay, that's a proven method. This is a short-term memory. Tomorrow afternoon you'll forget. 5 to 10 years. What is the question? That's not I told you in 5 to 10 years. Time period to get symptoms of AIDS. I told now, repeat MCQ. Symptoms for a AIDS patient comes by around 5 to 10 years. Not tomorrow or not next month. It will take 5 to 10 years for a AIDS patient to get symptoms of the disease. Heroin I was discussing now. Heroin. How is heroin taken? I told him that is an MCQ. Heroin is taken via injections. One more way. Any idea? Snorting. SNORTING. What is snorting? You write in the comment section. What is snorting? Okay. So heroin is taken by heroin. You remember the syringe, okay? Heroin is taken by injections and snorting. This was an MCQ, rank deciding MCQ which I asked some 3 years back, I think. There are specific dash for each amino acid. There are specific dash for each amino acid. Everything is the keyword. Everything are important words. Read the question. The answer is tRNA. tRNA. They'll give 4 choices. tRNA, tDNA, mRNA, sRNA, something they'll give and we'll be confused. Don't forget the question. Actually, you should study like this. What is the question for tRNA? That is how I should teach you. Question for tRNA is this one. Then you will not forget. Understood? Very good. So dash binds with specific amino acid. True or which one? Dash binds with specific amino acid. tRNA. 2 questions for tRNA. 2 questions for tRNA. Okay. Okay. tRNA usually pairs with dash. tRNA usually pairs with mRNA. tRNA usually pairs with mRNA. tRNA pairs with mRNA through dash. tRNA pairs with mRNA through dash. H bonding. Through H bonding. So what is the answer? Dash binds to specific amino acid. See, when they give 4 choices, you will not remember tRNA, mRNA, yRNA, sRNA because you have to prepare physics, chemistry equations. You will be very much confused. That's why I am telling you 7 days recall. Keep it in your brain. You can definitely take 90 out of 90 in biology. Definitely you can take. You hear all my videos. Will become punter in biology. What is the answer? It is tRNA. See, anticodons are found in this. So So many times they ask this MCQ. So many times. Anticodons are found in. Anticodons are found in mRNA. Anticodons mRNA. So this is a repeat MCQ. You also know this. What is the question for ribosomes? What will be the question? Ribosomes. What is the question? Come on. Site of protein synthesis. You know this. How many times they have asked? Site of protein synthesis. Ribosomes. So once you see ribosomes, you should tell the question. For that, you should do recall. Site of protein synthesis. Now, can you tell me this question? Question for tRNA. Question for tRNA. Read the question specifically. Question for tRNA. Dash binds to specific amino acid. tRNA. So one more question for ribosomes. Because ribosomes protein synthesis they have asked so many times. But next year, coming year, they are going to ask this. What is the question? Ribosomes, what is the question? Site of translation. Next year, coming year, they are going to ask this question and you are going to remember me. Okay. So ribosomes, protein synthesis is a old question, DAPA question, old question. But ribosomes, site of translation is a new question for next year, for coming year for you. Right? Or they can ask like this. This also they can ask. Protein synthesis in ribosomes is by dash. Like this also they can ask. Protein synthesis for in ribosomes is by translation. They can ask like this also. Anyway, don't forget Sheben, okay? Don't forget Sheben when you read this question. Translation. This is very important. Ribosomes, RIBOSOMES. Ribosomes are bound to dash. Ribosomes are bound to dash. mRNA. Ribosomes are bound to mRNA. Dash provides platforms for joining of amino acids. Dash provides platform for joining of amino acids. Read the answer thoroughly. It is given this page number in the textbook. If you even want to check it out. But don't forget the question, okay? People will forget the question. Read the question twice. Answer. Which one of the following can act as catalyst? mRNA, tRNA, rRNA, DNA, something they will give. This is a catalyst. rRNA. This is the classic NEET preparation video. Okay. Catalyst or RNA. rRNA is a catalyst for which reaction? I can ask like that, they'll give 4 reactions, make you confused. Which reaction? Peptide bond formation, they'll give 4 choice. rRNA is a catalyst for peptide bond reaction. rRNA is a catalyst. rRNA is a catalyst for peptide bond formation. Can you tell this question for tRNA? tRNA. Read thoroughly. tRNA. tRNA. So don't forget, after hearing this video, hear my part next video also in same YouTube channel, okay? Ribosome means ribosome means they'll give DNA, RNA, both none. Ribosome means just click RNA, come out. Okay. Peptide bond formation is enhanced by dash. Peptide bond formation is enhanced by rRNA. Don't forget the question. Normal heartbeat initiator. Normal heartbeat initiator. Sir, repeat MCQ. Not new question. Normal heartbeat initiator. Don't forget this SA node. Sino-atrial node. Sino-atrial node. Sino-atrial node. But you forgot the question. Read the question very well. Normal heartbeat initiator. Heartbeat starting place. Largest artery. ARTERY. Any idea? Largest artery. Largest artery is aorta. AORTA. Largest artery is aorta. See, don't forget to share this great awareness video. Okay, very useful for so many people. Okay. Oxygen carrying pigment. Oxygen carrying pigment. Pigment. Pigment is an MCQ point. Hemoglobin. They can also ask, hemoglobin is a pigment. True or false? That is also possible. You should know hemoglobin is a pigment. Separate MCQ, okay? This is direct MCQ. Direct MCQ. Fluid part of blood is called. Fluid part of blood is called. Come on. No choice. Don't remember the choice. Just answer. Plasma. Fluid part of blood is called plasma. Genetic material means DNA, RNA, both, none. They'll ask. So DNA material means, genetic material means DNA. Don't confuse, okay? So this one you know. Site of protein synthesis. Just now I discussed. Do you know the answer? Forgot, huh? Site of protein synthesis. Ribosomes. You will not forget. Ribosomes. Suicidal bags. Suicidal bags. What is the answer? Direct MCQ. Suicidal bags. Lysosomes. Lysosomes. Suicidal bags. Lysosomes. Powerhouse of a cell. Powerhouse of a cell. You forgot? Huh? Powerhouse of a cell. Mitochondria. Mitochondria. Powerhouse of a cell. Mitochondria. Functional unit of kidney. Functional unit of kidney. Functional unit of kidney. Nephron. Nephron. Okay? Nephron. Reduction division means. Reduction division means. There are standard MCQ. Repeat and repeat. Reduction division. What is the answer? Meiosis. Don't confuse with mitosis. Reduction division. If you see the word reduction division, answer is meiosis. No confusion. Cell division for growth. Cell division for growth. If you see this word, just type mitosis. Cell division for growth. Cell division for growth. Just click mitosis. Largest vein. Largest vein. Largest vein. Vena cava. Venacava. Largest vein is vena cava. Introns. Introns are removed by dash technique. So many repeat MCQ. This one. Introns. Introns removed by. Introns removed by. This is NEET preparation. Introns removed by splicing. Splicing. Or they can ask, what is removed by splicing? And they will give 4 choice. Introns, extrons, both of the above, none of the above. Splicing means only introns removed by. Very good. The word translation is for DNA. True or false? Tough MCQs, man. You cannot no logic business. Translation is for DNA. True or false? Unless you do recall, revision and all, you cannot memorize these things. Translation for DNA is a wrong statement. It's for RNA. Translation is for RNA. So this point they have given in your summary chapter. in your genetics summary, in the back summary column now, you can see the same point they are given. Life began around RNA, true or false? When I read that, it was quite different for me. Life began around RNA, true or false? Life began around RNA, true or false? It is a true statement in that text, in your textbook. Just go through that once more, okay? Life began true or true statement. Can you tell a question for transcription? Transcription. Translation we studied. We are discussing about ribosomes and all. Right. Transcription. Can you tell me a question? This is the way we should prepare for NEET. Transcription. Read. Primary step for regulation of gene respiration. They'll ask this. Primary step for regulation of gene expression. Primary step for regulation of gene expression. The answer is transcription. Will you not forget this? Good. The word dendrites, D-E-N-T-R-I-T-E-S, is related to what? The word dendrites is related to neuron. The word dendrites is related to neuron. Don't forget Dr. Sheban. Okay, stay tuned.